Please tell everyone your name.
I'm Desiree Jones.
And Desiree, what are you at McCracken Family Chiropractic?
I'm a massage therapist there.
Very good. And after I met you and you became a part of our team, what conditions did you have?
I had neck pain, usually right up against my head. I'd have a lot of pain. It would hurt actually to turn a little bit to the right. And then I actually had a little bit of low back pain too. I think it came from when I used to train horses and had a few riding injuries.
And so when was that? When did it begin? Years ago?
Yeah, years ago.
So I've been there a while, and we think that's what caused it. And then your neck, you've been a massage therapist. You have a lot of strain and tension from looking down at your client. So what did it feel like when it was at its worst?
I would just feel like there would be just several, like my body was just coming together and converging on one spot of pain. It just felt stiff, and I wouldn't be able to move, and just overall it was kind of a miserable feeling when it got to its worst.
And what had you tried to get rid of the symptoms of the condition, and what were the results?
Well, as a massage therapist, I tried several things, stretching, different types of exercises, seeing another, massage therapist, and it would help temporarily, but it never stayed away for more than a couple days.
Okay. My next question would be, chiropractically, when we first examined you and x-rayed you and I made you sit for the doctor's report, what did you think about chiropractic prior to starting?
Prior to that, I thought it was just pain management. Every experience I had with a chiropractor, with family, would be they would go only when they hurt and nothing beyond that. And then, whatever problems they had originally would just come back later when they stopped seeing the doctor.
And the miracle story that we have to share is you joined our team around the first week of December, and shortly thereafter, tell us what you found out.
The third week of December, I had previously gone to the doctor because I hadn't been in several years, and they told me that I had cervical cancer and that it was a low level. It was just a stage 1. I think it was stage 1A2, I think is what they said. And they wanted me to have, several surgeries, or just one, really, elite procedure, and I chose not to do that.
Or a hysterectomy, yes? Was that one of the options?
Yeah, it was one of the options. Basically, they said because it was the type that would spread, that could metastasize, I think is what they say, that they wanted to, go in and do the elite procedure, but that chances are it may not get everything. So the worst and last option would be just a hysterectomy overall. That way I didn't have to deal with it.
And you're how old?
25.
And do you have children?
No.
Do you want to have children?
Most definitely.
So what would happen with a hysterectomy?
No chance of that. I'd have to adopt, which would be great, but that's not what I want.
So you have low back pain, and we know the nerves in the low back and the lumbar area go to what organs?
Well, of course, the uterus and ovaries and everything else.
The reproductive organs. So the pain, the pressure on the nerves told us that there was some kind of disease going on, whether you knew it or not. And it took us to taking the medical test to find out that you were actually diagnosed with, do you remember the specific name? The squamous?
I think it was squamous cell
carcinoma.
Yeah.
Okay, that's what you had said. So squamous cell carcinoma is a malignant skin cancer that can be found in the organs, and in your case it was found in your cervix, correct? So I remember you coming to me very sad-faced because you just met, and you said, well, Dr. Michael, what are we going to do? Do you remember what I told you? I do.
I don't remember exactly what you said.
I told you I'm going to do what I do every day, and that is I'm going to adjust you, and we're going to need to change your diet and make sure you're exercising. But every day that you were in this office, I told you I would adjust you, and you travel a lot, so every day that I've seen you, we've done that. You have started exercising. You've actually recently lost how many pounds?
15.
She lost 15 pounds. We put her on a strict program with our cleanse diet to start removing the toxins in her body, just to start starving the cancer and start killing it off, allowing the immune system to destroy it. So we've lost a lot of weight very recently, and then yesterday you went back for your checkup. Now, you ignored the doctor's letters, certified letter sent to you saying you must come in and have
they
this
called
addressed.
me and sent a certified letter and everything.
Because you weren't doing
what they wanted.
You weren't doing the surgery, you weren't doing chemo, you weren't doing radiation, you weren't doing anything that they wanted you to do, because you were going to allow your body to do it and your body to heal itself. And yesterday morning you went back for your checkup. You did go back and had your test run again, and what did we find out?
We found out that it's gone. There's no cancer at all. It's just gone. There's a few abnormal cells, but that's very, very common with all women of any age, and there was really nothing at all. It was gone.
So it was a great day at McCracken Family Chiropractic for one of our family members and our close friends that we knew that we had to help, but it took not only what we do through chiropractic, but it took a little bit extra. It took determination on your part, and I applaud you for it. I know there's a lot of people that are going to watch this video, and hopefully there's no dry tears watching this, as we shared some yesterday, because God has truly worked through me and through you, but your body is what did the work. I moved the bones, and somebody else did the healing. The power that made the body heals the body, and that's why you're sitting here as a miracle cancer-free patient today.
4 months.
In 4 months. Yep, it took 4 months of a lot of work and chiropractic care and nutrition and exercise, but in 4 months we found out yesterday that miracles do happen, and the body heals itself. Thank you.